major cohort of patients that have shoulder problems are diabetic patients. Almost 1/3 of diabetic patients can present with a frozen shoulder. And that typically occurs 5 to 6 years after they've started their diabetes medication. Once they have a left-sided frozen shoulder, about 5 to 6 years later, they will get an opposite side frozen shoulder inevitably in almost 30% of those patients. When they get a second affliction of the frozen shoulder, the second time is much more intense than the first time, is disabling, very painful, and they come up with a very remarkably stiff shoulder joint. As it is, diabetic patients heal poorly. Any wound will heal with a lot of delay in diabetics, and that is why diabetics take a much longer time to respond to any exercise program. As opposed to your conventional patient who has a decent range of movement, he can exercise better with a better range of movement, strengthen faster. Diabetics have a very stiff rotation, and that's why it will take double the time to strengthen. The magic of PSRP is such that because there's a large emphasis on strengthening of the rotator cuff, the strengthening and restoration movement happens synchronously, and that's why they will tend to improve their movements and strength progressively, and that by itself will bring down their pain. PSRP is a scientific exercise program that has stood the test of time for 23 long years. It is the success of PSRP that has allowed us to treat the patients with exercises without resorting to painkillers or steroid injections. The Wizio app allows you to do the PSRP exercise program anytime, anywhere, at your home, any time of the day.